Introducing the Digital Health Infocast Partnership Series. Join leading organizations to discuss the cutting edge of digital health. Healthcare is evolving. The conversation is too. This special podcast series launches December 21st. Tune in wherever you listen to podcasts or visit infoway-inforoute.ca/podcast.
Hello, everyone. Happy holidays to you. As you can see, I am pretty much getting prepped for the season, and I certainly hope you are too and that you are well. I want to welcome you and thank you for joining us for the Canada Health Infoway Virtual Partnership Conference. I have the pleasure of being your MC today. I'm Suhanna Marchand. Now, we do have attendees participating from across Canada and around the globe. And just allow me, if you will, to take these opening moments together to acknowledge that the lands on which we are hosting this event include the traditional territories of many nations. Canada Health Infoway recognizes the many injustices experienced by the Indigenous peoples of what we now call Canada, and that they continue to affect their health and well-being. Canada Health Infoway respects that Indigenous people have rich cultural and traditional practices that have been known to improve health outcomes. I invite all of you as attendees to reflect on the territories you're calling in from as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. As a journalist, I cover national and international stories, and I have the great privilege of interviewing newsmakers from around the world. And as you know, a top story in these times is the pandemic, new variants, and how we deal with them. Omicron is the latest concern, and all of this has really put the spotlight on healthcare. Healthcare, how we access it, how we deliver it, how we participate in our own care strategy, really important avenues that we can discuss throughout this conference. This partnership conference, by the way, is taking place during Digital Health Week, which runs from November 29th to December 5th. It is an annual celebration and recognition of how digital health is transforming the delivery of care across Canada as more and more of our healthcare system becomes digital, and you're probably a part of that. This partnership conference is taking place with many avenues for you to get together, chat, and discuss your ideas. So let me help you to navigate today's event. We have simultaneous interpretation available for all Infoway Partnership Conference sessions. So to listen to the session in French, select the French audio button on the upper right of your page, and then it's simple. You just follow the instructions. We also have closed captioning services available. To enable English closed captioning, simply select that CC button that you're seeing on your screen. It's on the bottom right of your video player. The Virtual Infoway Partnership Conference is proud as well to be patients included. And Infoway is pleased to continue to convene events which adhere to the accreditation. In collaboration with its patient partners, Infoway has developed the Patient Family Caregiver Recognition and Inclusion Statement. And this statement acknowledges the critical role of patients, families, and caregivers and underscores Infoway's commitment to collaborate with them as we work toward improving the health system. Let me just read this statement. We recognize the unwavering commitment and essential impact patients, families, and caregivers have and will always have on the Canadian healthcare system. Canada Health Infoway pledges to continuously listen to the perspectives and learn from the lived experiences of patients, families, and caregivers to ensure respectful collaboration in the work we do and influence. We look forward to building true partnerships and acknowledging shared successes. Now, the patient advisor for this conference, I want you to welcome her, is Anne O'Riordan. Anne has been an advisor for the overall program development. So Anne, a sincere thank you from the team at Canada Health Infoway for your support. I know it takes a lot of energy, but you're there. So great to have you as part of this conference. I will also ask you this throughout the day, to check out the polls and to share your experiences. This is about communicating and connecting. You can find the live polls on the right side of the main stage video stream, as well as in the concurrent rooms. And we have planned to allow for questions during some of the concurrent sessions, should time permit. So you can submit your questions, because again, it's interactive. Submit your questions throughout those sessions via the Q&A box, which is under the video stream. And we welcome you to engage with your fellow attendees in the platform chat. And you can find that chat by clicking the blue talk bubble icon. It's at the bottom right-hand corner of the screen, and then select the room you would like to join. And right now, because we're on the main stage, that's where you would join. And then later during the concurrent sessions, you will update that choice to match the room that you are in. Make sense? I'm sure it does. And the chat, by the way, can be used to share your comments with all attendees, or you have another option. You can message specific attendees directly. And be sure to network with our hosted moderators and other conference participants in the Connect Live rooms during the scheduled networking breaks in this agenda today. And you can find the Connect Live rooms linked in the main menu on the left-hand side of your screen. I know it's a lot of information, but you will get the hang of it, and you'll understand what those icons mean and make it a better experience for all of us. So we've done the housekeeping. Let's get to the program. We kick off with a presentation by Canada Health Infoway's President and CEO, Michael Green. So please join me in welcoming him to the virtual stage. I'll hand it over to you, Michael.
Thank you very much, Suhana. And you must be the best anchor for CBC, and certainly the best anchor that we have working on our partnership conference. So it's great to be working with you again. I think my slides are up here. So I've got a brief presentation, about 20 minutes, and at the end of which I have a short video, the CEO of Kathy Hay, who is the president and CEO of Kids Help Phone, an organization that we've worked with fairly closely, or very closely actually, on mental health issues for youth. And so Kathy will give a couple of minutes update of where her activities lie now. So title of this talk is the Digital Health Leap. And I think the thing is that, we don't want to necessarily be like the buffaloes that leap off a cliff and pushed by the crowd and bash their brains out on the rocks below. We'd rather be the leapfrogs that kind of leapfrog over the system into new technology. And so if I get to my next slide, well, apart from having a new Omicron variant of COVID, and 2021 was the year of COVID, 2021 also was the year that Infoway celebrates its 20th anniversary. And the organization has been around since 2001. Since then, it's had $2.1 billion worth of funding from the federal government and collaborated with the provinces and territories on a number of programs, probably with a total spend of around about double that if you look at the complete investment that's gone in. And Infoway was founded originally to basically help the PTs and the federal government come up with a strategy for the electronic health record, which really was beginning to be adopted across the country at that particular time at very early stage. And so it was a kind of foundational moment. And perhaps now in 2021, when we look at digital health, and the initial EHR program was largely based on hospital information and so on. Now we're looking at bringing the information in a much more collaborative format, ultimately to patients, but certainly to facilitate their healthcare. And so, I think it's a time now where perhaps we, on the next slide, go, as I might coin the phrase, back to the future. So I'm sure you all remember this movie, which had the DeLorean car in it, and basically, it was able to travel back to time. And there are a lot of scenarios where people travel back from the future to the past and back and forward and so on. And I think if we look back at the past, we know that Infoway started off working with all the provinces and territories on the electronic health record. And if you look at the next slide, we can see that the original work, which many of you probably remember, certainly before my time at Infoway, that surrounded the EHR Blueprint. And the EHR Blueprint really, in the end, was an architecture design that came up with an architecture for provinces and territories to have repositories to store electronic health data. And that system is still used today. And, I think that I remember my predecessor, Mr. Alvarez, used to quote Monty Python and the Search for the Holy Grail. And I think the Holy Grail in his analogy was the Pan-Canadian health record. And certainly, if we want to see effective use and implementation of digital health, we all know we've got to have the data to support that. We've got to be able to send that data seamlessly between different caregivers and ultimately to the patient as well, and facilitate good patient care. And we have seen during the pandemic, I'll talk about in a second, proliferation of a number of virtual care services. But to be really effective, those services have got to be well coordinated, and they have to give the caregivers and the patients a complete picture of the health situation so that they can really add value. And so that is going to be a focus for our organization over the first part of the next 20 years that we're talking about. So in a sense, we're going a little bit back to the future, but focusing on some of the enablers that will really help the digital health system blossom throughout Canada. So the next slide, moving on from there. And as we all know, an awful lot of things to do, even in the last year, since 2020, actually, if we look at the impact of virtual care, on the right-hand side, you can see that, the economic benefits have been 6.1 billion and, 90 million hours in travel time saved. So there's a good benefit for the population, for healthcare workers as well. And we need to see that we can continue realizing this and creating even greater benefits going forward. I always like to quote the figure that since Infoway has formed, $43 billion. That's a kind of $20 return on each dollar invested, which I think exceeds the TSX and the SP 500. So it's clearly a very good investment for the country to make. So moving on from there, and let's talk a little bit about what's been happening during the pandemic to take us to where we are right now. And so on the next slide, we can see that there was an accelerated uptake of virtual care. And so if we look at the number of virtual and in-person healthcare encounters, we saw 62% of total visits were conducted in person, 38% were conducted virtually. Prior to the pandemic, it was probably less than 10%. 7%, I think the figure was. So we've seen a great increase. And the breakdown on this particular slide shows the reasons and purposes that people use those visits for. And we can see how, visiting a family doctor and walk-in clinics and so on. And then on the right-hand side in the blue, we can see how those visits were broken down virtually with those different groups. And we all know that there are various different use cases, but the encouraging thing is that virtual has played a significant role in improving quality of care in a safe way that prevented unnecessary face-to-face encounters. The next slide. And of course, we all know that there are preferred models for virtual care. And again, on this particular slide, and I think we'll make these available after the meeting, it shows here the kind of key use cases. And when we look at the bottom, following up a health problem, when people have their initial consults for minor issues, virtual care plays a great a role, and then in prescribing. But even in areas over and above that, mental health has seemed to be a great use case. And then perhaps some of the more sensitive discussions that patients want to have with their caregivers, they may feel more comfortable doing some of those in a virtual environment. And we can see these preferred modes will change over time, and perhaps are also subject to the amount of backup and support that comes along with these systems in place. Moving on from there, this really shows an international comparison. I think it's the OECD, and basically prior to the pandemic. And this is particularly focusing on the area of primary care. So, we put an awful lot of work into electronic health record, diagnostic imaging, lab results, and so on and so forth. And now the key really is to open up the primary care sector. We know now that nearly 90% of physicians have primary care EMRs, and so we're in a great position to enhance the use there. As you see from this chart, we started off with a fairly poor base, but again, we saw some great improvement during the pandemic year, and this is something that we need to sustain going forward. Looking to the next slide, this one really shows an idea of the number of programs that we've been running over the last 18 months related to virtual care. And, this was in coordination with a program that was announced by the Prime Minister, $200 million program, and also some of the other investments that Infoway switched from legacy areas to assist with the pandemic. And we're working, the message really is that we're working across the country. So every province, every territory is working on virtual care and digital health. And we've also been helping and supporting them in various different ways in terms of that implementation. But the good thing is, and I think during the whole of this pandemic, there's been a huge level of cooperation, communication between the federal government, between the provinces and territories, and we're very happy that we've been involved in a number of those, specifically around digital health and virtual care, to see how we can have a more coordinated approach going forward. Now, next slide. So getting back to the theme of getting back to the future, I wanted to focus a little bit on where we see ourselves going and the possible scenarios going forward. So again, on my next slide, this is some work that our team conducted last year. It was also based on a number of stakeholder interviews across the country, various different groups, and it was trying to set a scene of where do we see ourselves going after the pandemic. What are the kind of different scenarios? Are we going to slip back into the lower left-hand quadrant where we would be fighting fires? Or are we going to go and adopt a smart health society? And if we do adopt a smart health society, what does that look like? What needs to be put in place to make that adoption? And I think that's where we obviously would love to go. And I think when you talk to healthcare providers across the country, that's definitely what they want to see. And so what does that encompass? And again, if we move on to my next slide. And so if we look at the kind of ideal future of a digital enabled health system across Canada, providing equity of care, regardless of who you are, where you live, your social status, and so on. So one of the things is really to have an activated Canadian people who are able to proactively manage their healthcare if they wish to do that. And also really enhancing the availability of data, not just to have the charts available, but also to make it provide insights and to help improve care and the safety of care. We want to make sure that citizens and healthcare providers are at the center of the design, that they help to design the system for success. And that also, in terms of the workforce, the clinical workforce, to have tech-savvy workforce, to look at the curriculums of training and so on, to ensure that we have all those building blocks put in place. And in the end, investing in the health sector and the innovation sector will be a good opportunity to make this an economic driver for Canada. We've seen a number of new companies come up in the digital health and the health innovation area, and this is something that is great for the economy, and hopefully we can export a number of these things going forward. Moving on from there to the next slide, and of course, here's a picture of Doc with one of his weird gizmos on his head. We also need to be looking at what's coming along. It's a moving field. What is artificial intelligence going to offer us? What is quantum computing going to offer? Where will areas like robotics take us in the health system? So having a bit of a lens on the future and being able to prepare for some of these exciting new innovations and ensure we're ready in advance to handle them. So my next slide, which I think is nearly my last one. So really, in summary to that, I think we're all looking forward to a much more sophisticated, digitally enabled health system, one that delivers care that's close to home, sees personal health information flow seamlessly between care settings, and offers that equity of care for all Canadians in correlation with the kind of objectives of the Canada Health Act and equitable care. And I think our focus, of course, is on the solutions, but we also realize, and from the beginning of my presentation, that to be really effective going forward, we need to have a core strategy and we need to have milestones and objectives we're going to work towards. Releasing that data, making it ubiquitously available to caregivers and patients in a safe and private and confidential manner is a key goal. And that is the next stage, really, moving on from the original blueprint. And I think Infoway is in a great position to help facilitate a lot of that change and drive the change, bringing together stakeholders from industry, from the healthcare sector, and from government as well. So that kind of comes up nearly to the end of my presentation. And I did say that on the last note, I was going to hand over to Catherine Hay, the CEO of Kids Help Phone. And I think we have a short video clip that we're going to play. And with that, thank you very much. And I'm going to look forward to some of the following presentations that come along. So perhaps we can cue the video. Thank you.
Thank you, Michael, for the opportunity to speak and share a bit about our story as Canada's first and only national bilingual 24/7 e-mental health service for young people from coast to coast to coast. As President and CEO of Kids Help Phone, it is a pleasure to acknowledge how grateful we are for the continued support and partnership that Canada Health Infoway has provided. Kids Help Phone began our partnership with Canada Health Infoway in 2017, recognizing your organization as a founding partner to our national texting service, our catalyst partner. Since then, we've been working together on initiatives which strive to break down barriers and ensure equitable access to digital health care. This is particularly impactful now during these unprecedented and challenging times. We continue to see enormous need across the country for our services, and since March of 2020, Kids Help Phone has provided service to youth across Canada more than 9 million times. In this past year alone, we have worked closely to launch 2 vital initiatives: the peer-to-peer community at Kids Help Phone and the brand new gateway at kidshelpphone.ca, empowering more young people's well-being with the support they want, when, how, and where they want it. With the continued support of Canada Health Infoway, we are able to pioneer in virtual care and provide youth the assurance that we are part of their future whenever they need us to be. Thank you so much.